For your health tonight, millions of Americans suffer from insomnia and depression, and we may have a new way of treating them together. A new study out of Toronto found that talk therapy for people battling sleepless nights also produced remarkable results in depression. News 4's Dr. Peter Ostrow is taking a closer look into this.
Insomnia and depression are often encountered together, but we always thought the depression came first. Maybe for many people, it's the other way around. It's been reported in the mass media and hasn't appeared in medical journals yet, but the results of this study are striking. 87% of patients who resolved their insomnia using a treatment called talk therapy also recovered from their depression.
I'm surprised, actually. We all know that depression plays a role with insomnia and insomnia plays a role with depression, but I don't think anyone would have thought talk therapy to help with insomnia would help that much.
Dr. Sandra Block is a sleep medicine specialist at the Buffalo Medical Group. She often uses talk therapy with her patients, but serious sleep problems usually need to be investigated to make sure there's not a medical problem also, like sleep apnea.
And actually, insomnia and sleep apnea and depression can be commonly seen together, especially in women, middle-aged women, elderly women. That can be part of the presentation is actually insomnia and depression for sleep apnea. So that's one thing you don't want to miss.
Real insomnia is more than just a few bad nights' sleep. Many psychological components of insomnia can be identified and addressed by talk therapy.
How do you feel when you go to sleep? Are you brushing your teeth and already worrying about your sleep? Do you sleep better in a hotel? Some people actually sleep better in a hotel because they're so frightened and so conditioned to dislike their bed that when they're in another place, they sleep better.
Now, that's the sort of anxiety that might be helped much more by talk therapy than by a sleeping pill. The new information that patients treated for insomnia also recover from their depression is very encouraging. And if that claim holds up, it may actually change the way many people are treated.
I think that's great, just talking about it. But how do you know? You said serious sleep problems. How do you know if your sleep problems are serious?
Well, okay, most of us have had a bad night's sleep or even a few bad nights' sleep from time to time. But if it's persistent, if it interferes with your work or your social life, or your other functioning, okay, that's time to see a doctor. And there are many treatable medical problems that may first show up as sleep disorders, so they need medical attention.
All right, very good. Thank you, doctor.